Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner, Tata Trusts.
Hello and welcome to this special episode of Sanjeevani, United Against Cancer, an initiative by News 18 Network, Federal Bank Hormis Memorial Foundation, Tata Trusts and Novartis. I'm your host, Gautam Srinivasan, and to set the context for today's conversation, ladies and gentlemen, India's cancer burden and mortality are on the rise. With Sanjeevani, we are striving to reverse the trend by raising awareness about the importance of regular screening and timely detection of cancer. Today, we are shining the light on a crucial message. Early detection can save lives. With October being the Breast Cancer Awareness Month, it would be fitting to share that as per a study by the Indian Council of Medical Research, 1 in 29 women are likely to develop breast cancer. But on the brighter side, if breast cancer is detected early, it is often treatable and associated with higher survival rates. Now, as we embark on a journey to ignite change and inspire action, let me take this discussion forward with our esteemed panelists. Let me begin the introduction, starting with Amitabh Dubey, Country President and Managing Director at Novartis India, Rekha Gulabani, Patient Leader and Director of Resources at Indian Cancer Society and a breast cancer survivor herself, Dr. Ullas Batra, Co-Director, Medical Oncology at the Rajiv Gandhi Cancer Institute and Research Center, and finally, Dr. Nitesh Rohatgi, Senior Director for Medical Oncology at Fortis Memorial Research Institute at Gurugram. Thank you everyone for joining us for this very important conversation that is necessary in the context of today's times. Thank you so much. Rekha ji, let's start with you. You're a survivor yourself. So I want to know more about that journey that you have faced. And also this question that comes to my mind as to why is screening not done more often? That is a key question because it needs to be done regularly. What do you think is the reason? Is it fear or is it just that ignorance is bliss? What do you think is the key?
I think, of course, ignorance is there. But if I talk about myself, I was not ignorant. I did know in 94 that I might be having breast cancer, but I ignored it because I thought cancer means death at that point of time. And I ignored it for 3 years. And when the things became very bad with me, I was in a very bad shape. I was taken to the hospital and the doctors hardly had any hope of my survival. But by grace of God, now it is more than 25 years, I am still alive.
Absolutely. Some very important lessons learned in that journey. And I want to take that forward and get the experts and their views on this. Dr. Batra, let me come to you. Your thoughts on this, because when we look at it from a detection perspective, it is the most obvious answer. But when we look at studies, I'm seeing one where it says that a high proportion of cases are being detected, they are at a later stage. And studies have pointed out that 70% of breast cancer cases, they are diagnosed at stage 3 or 4. So first of all, the different stages of cancer, if you can clarify for our viewers, and of course, the benefits of being diagnosed at an early stage.
So in US, 20% of cases are diagnosed in stage 4. In India, it is 80% of cases which are diagnosed in stage 3, stage 4. The benefit of early staging, if you are diagnosed in the early cases, breast conservation is an option. Patients don't have to rule the entire breast. If you diagnose in, let's say, stage 3 disease, maybe you'll have to remove the entire chest wall, the entire breast will be there. Number 2, chemotherapy, the dreaded chemotherapy. The moment you ask somebody about cancer, the first image which comes is ki chemo nahi leni hai. You can be spared of chemotherapy if you're diagnosed in stage 1 and stage 2 disease. However, in certain cases, not in every cases. In stage 3, definitely you'll have to take chemotherapy. In stage 4, obviously the intent of treatment is only to control the disease and cure the disease. The third important point is the duration of the treatment. In stage 1 and stage 2, the duration of treatment can be less. Chemotherapy may be given for, let's say, 2 months, 3 months maximum, target therapy for a year. But if you're diagnosed in stage 4, when you can only control the disease, the treatment can go on for years and years altogether. So it is very, very important to do screening. You spoke about the stages. To put a layman's this thing, stage 1, when the disease is only there in the breast. Stage 2, stage 3, when the disease has spread locoregionally, maybe to the axillary lymph nodes and to the internal mammary lymph nodes. Stage 4 is when it has gone to the lungs and liver and bones, etc. So stage 1 to 3 are potentially curable. Stage 4 is only and only controllable. Very, very few patients get cured of the disease.
But I also want to get a sense from you as a medical professional, because as we said, stage 1 to stage 3, the earlier the stage that you detect it, the chances of you having a cancer-free life increase exponentially. But also I want to get your viewpoint on, if you are at a later stage where you have detected it, what do you do? Is it the end of the road? How do you handle it?
So I again feel that Rekha ji brought a very good point forward, that it was the fear of death. You see, when you ask 100 people, think the first word that comes to your mind when I say cancer, they'll say death. And it is so amazing that in breast cancer, in 2023, that's actually not a reality for majority of patients. And I'm saying that with confidence, majority of patients. Of course, we've had chemotherapy and the chemotherapy is only getting better. But 2/3 of our patients can be managed, life prolonged, quality maintained, go to work, travel, be a part of their children's and their life by a tablet a day. Amitabh will tell you more, there is more technology coming out there, but a tablet a day, a drip targeting your cancer specifically without all the side effects of chemotherapy, often can prolong life into years. Now we are seeing decades. And the best part is chemotherapy has become the bridge to take you to the point when this treatment is possible. I think life is changing and it has changed. And if breast cancer is spoken about, death is not a reality for majority of patients, at least at diagnosis.
Words of reassurance which are necessary for a whole lot of viewers who are watching this, because sometimes misconceptions also play a role in kind of enhancing the fear that you have of having the disease.
And not going for screening.
And not going for screening. That's a very important point there. All right. But you also set up a nice point for Amitabh to talk about that innovations which are happening in this space, because Novartis is doing a lot of innovations in this space in terms of cancer treatment. So your thoughts on the digital technologies and innovations which are in the pipeline to kind of alleviate this disease?
Thanks, Gautam. And I'll take forward from where Dr. Rohtgi left. At Novartis, we believe in reimagining medicine to extend and improve patients' lives. And in cancer, we clearly believe that we will put all our efforts to potentially have a cure for cancer. In Novartis, we have been constantly working to improve and extend patients' lives for cancer care. We have got more than 25 molecules which are today available for patients, and we have got more than 30 in our pipeline where we are targeting various pathways. We are not just looking at targeted therapies, we are also looking at innovative technologies like cell therapy, radioligand treatments, which are newer treatments to treat patients with cancer. When it comes to breast cancer, our journey has been for more than 3 decades now. And in the last couple of years, after almost 20 years of no advances in HR positive, HER2 negative breast cancer, we have been able to come out with CDK4/6 inhibitors, which are targeting newer pathways. We've had 3 pivotal trials spread across premenopausal, postmenopausals, thousands of patients, and we've been able to demonstrate quite significant overall survival. So overall, we have been constantly targeting and extending patients' lives. We are still a bit away from the cure, but our intent is to continue, keep working and have those outcomes for patients. Now we are also targeting early breast cancer and ensuring that 1 in 4 patients with early breast cancer is able to prevent a relapse with effective treatment.
So curative and preventative,
Exactly.
you're covering both aspects. And it's great to see the innovations which are coming about in such a rapid pace. And they're also taking center stage in terms of an audience visibility. The audience gets to know that these are the conditions, but these are also the solutions which are available.
And if I add one more point, they're now coming to India. It's not only a thing of the West anymore. We're getting them to India, which is something very proud about.
Absolutely, that's crucial.
Another interesting point would be that globally 16% of all research funding today is going in cancer treatment.
Well, I hope The cure is in sight. But before we wrap up this segment, Dr. Batra, I want to get your point in on this visual mnemonic that people have, especially when it comes to cancer. This is where media, TV, social media has played a part, where they see these soap operas and the moment cancer is mentioned, hair loss is associated. So all these visual mnemonics, they also create a sort of a fear psychosis in a lot of people. So your thoughts on that?
So I think, again, as you said, the times have changed. When we were growing up, tuberculosis was the worst thing. You wanted to kill someone in Bollywood, you get them diagnosed with tuberculosis. Now cancer has become the new fad. But the point here is, hair loss, small side effects are temporary. Look at Rekha ji. Can anyone see and say she's a survivor? Also see all the celebrities who have recovered from those. It takes 4 months for the hair loss. It takes 2 months for hair to come back. That's it. Plus, as both Nitesh and Amitabh ji said, there are oral medications available, hormone therapy available, which do not cause hair loss. There are techniques like targeted therapies. You give trastuzumab, you give pertuzumab, ribociclib, letrozole. You ask for that, you have the drug. And as Nitesh very rightly said, available in India at almost every oncological center. You also have scalp cooling techniques that even with the chemotherapy, you take some techniques over there, you won't have hair loss. In fact, I have got patients, young patients, who come in the morning, take their chemo shots, go back home, next day they are working. Or maybe same day. I've got doctors who are working the same day, operating, doing ultrasounds and all. Cancer is no longer the stigma. I think we need to now, anybody comes to me with breast cancer, I tell them congratulations. ठीक हो जाएगा. Don't worry about that.
It's amazing how innovations can actually change the outcomes of a lot of issues which happened earlier. Dr. Rohgi, in the previous segment, we were discussing all these possibilities in terms of treatments and innovations that have come about, a positive transformation, so to say, and you've been privy to a lot of the action that has been happening. So a message to breast cancer survivors, according to you, that they should know about right now.
Early diagnosis is the best way for breast cancer to be detected. I think we must accept that the cancer is going to be a part of every household. So as the last said in previous segment, that breast cancer is somewhat more curative and easier. So please go for detection. Please go for your mammogram. At least do self-examination once a month, at least. And prompt your friends, prompt your family to do that. And last but not the least, if you feel there's something wrong with you, and you go to a doctor and he says this is not cancer, but you're convinced that this is not right, actually go back.
Action is always key. Don't be passive when it comes to breast cancer. Absolutely.
Early detection saves lives.
Can I just add something to what Dr. Rohgi said? Generally, the perception is cancer happens to every other person except me. And that needs to be avoided because it can strike anybody at any time. There's a high amount of awareness about breast cancer. But people generally think that it's not going to happen to them. It can happen to everybody else, but it can strike anybody. So people need to ensure that they do the regular examination, and it's early. It's best that if detected early, you have a huge chance of having a cure.
And you need to be active when it comes to your health, because if you are proactive, a whole host of factors work to your benefit. And it harks back to what Rekha ji had mentioned, because as you said, if it becomes ignorance is bliss, sometimes you just want to avoid the problem rather than being active and trying to solve it. Rekha ji, the Indian Cancer Society, it's been working very actively to empower breast cancer patients to stand up to this and triumph over it. So your thoughts on 2-3 key factors, a message of hope. We have received a message of action from you. I'm looking for a message of hope. 2 or 3 key factors that keeps patients motivated, and also if you can talk about the fear that looms in the background.
Actually, the thing is, NGOs like Indian Cancer Society and other NGOs are very helpful in spreading message in the community, as Dr. Rohgi said, because it should be a mass communication, talking to the general public and creating awareness about the risk factors, symptoms and prevention of breast cancer to the people going from every nook and corner. We go and talk in the villages, schools, remote areas, and then we train somebody like ASHA worker and other people about this, and teach them breast self-examination and all that. And we take our screening van over there to screen those people. We motivate them to come for this. And as he said, we should go for early detection. Motto of Indian Cancer Society is conquest of cancer by choice and not by chance. And to tell you the truth, amongst all the non-communicable diseases, cancer is the best. Why? because it is treatable and curable. Like myself, we can become cancer free. But once diabetes, blood pressure, heart disease catches hold of me, I will have to adjust and manage it throughout my life till my last breath. So now I am cancer free. So cancer is the best amongst all the non-communicable diseases. The problem is we should have spread the message to each and everyone, so that each and everyone is awakened and empowered, and they go to the doctor, and early detection would save the organ of the body. It would they would give you less treatment. That means less cost. That means less time. That means almost 100% chances of cure. So this is the message we should spread, and we should not be scared of cancer, you know.
How do you deal with that fear? Because for some viewers, they might be watching and saying, you know what, it's easy for you to say. How
to fight with those fears? This was taught by Novartis to us, you know. They had a workshop on peer navigation, where by default, Indian Cancer Society has always been doing peer navigation, because most of our volunteers who go to the hospital are survivors like me. So when we go and talk to the patient, they get the hope, if she can survive, even I can survive. Number one. Number two, they trust us more because they know we have gone through the same experience. If a person who has not gone through the same experience, they would say, okay, isko kya pata? They have not gone through it. But they trust us and believe us. And secondly, people don't want to talk to their family about the sad part, because they don't want to increase the anxiety of the family. So they would rather talk to us openly. I have got a very big group of metastatic breast cancer patients or survivor, whatever you call them. And they have been with me for last more than 10 years also, and a few of them live for 13 to 14 years also. You know, we taught them about the awareness, and they go to the remote villages where they stay, and when they create awareness, when they help others, they feel very empowered, confident. And I have got a few patients, metastatic, who are pradhan of something or chairperson of something, and they are called the Iron
moving
Lady.
forward.
They look forward to that attention, that celebrity type of attention, and they forget about their disease. That boosts their confidence. And when people look at people like me, survivors, they get the hope. So that is the thing. So, and then you say, one should not, वो कहते हैं ना, ये मत कहो प्रभु से मेरी मुश्किलें बड़ी हैं, ये मुश्किलें तो कह दो मेरा हौसला बड़ा है.
अरे वाह, क्या बात है. Amitabh, before we wrap up, a quick message from you on this, because Rekha ji has credited Novartis with a lot of work that it's done. Talking about innovation, Amitabh, Novartis has been working actively with all stakeholders in the ecosystem to make innovation equitable and accessible. Tell us why that's necessary in this context.
At Novartis, we have a three-pronged approach. Correct? We keep patient at the center of what we do, and that's very important for us. Right from our clinical research, that means designing of trials for new drugs, we get patient views into ensuring that we are having the right design and moving forward. The second most important part is that we clearly understand from them the journey that a patient, especially for breast cancer, undertakes from diagnosis to treatment to potentially moving into a metastatic stage. How does it move forward for him? And understanding that helps us into our research perspective. Second, we closely work with healthcare professionals, doctors like Dr. Rothigi, Dr. Batra. They help us to guide and also help us together to work to disseminate scientific information and work across to let everybody know about cancer, awareness, what's the right time, diagnosis. In India, we see a younger population as compared to West. So it's important that after the age of 40, we should start having the screening. And the third most important is we have been working a lot with various other stakeholders, typically with government. We ran with the Japaigo, with the Orissa government, a whole project of empowering people to know about early breast cancer, signs and symptoms, so that people can do self-examination and know about it. Recently, we signed an agreement with MOU with the Assam Cancer Care Foundation and Tata Trust, again, to ensure that we are able to bring the funnel a bit narrower. And what I mean by that is the patient are able to diagnose themselves early, and if early diagnosed, they are referred early to a center of treatment. So what we basically try to say is that we have to have a collaborative mindset. All stakeholders have to come together. Bold science, collaboration, and patient at the center of what we do will help us to drive against this epidemic.
Dr. Batra, any quick words from you?
My message to all the patients usually is, cancer is just a word. It is not a sentence. It is not a death sentence, definitely. It is just a small part of speed breaker in your life. It's not the full stop. And I always tell them, जब अच्छे दिन नहीं रहे तो बुरे भी नहीं रहेंगे. The best thing about time it will change.
Absolutely. Message of action, message of hope, and message of progress coming forward in this conversation. But with that, we come to the end of this conversation. Sanjeevani United Against Cancer special broadcast. A big thank you to all of the panelists for joining us here and sharing their perspectives and invaluable information on this platform. And ladies and gentlemen, remember, early screening is key to overcoming breast cancer, and together we can ensure that no one fights this battle alone. Let's continue to spread the word, lend our support, and take action not just in October, but every single day. Let's take a pledge to stand united against cancer. On that note, thank you so much for watching.
Federal Bank and News 18 Network present Sanjeevani United Against Cancer. Knowledge partner Tata Trusts.